Hello, I'm Jonathan Esquivel from LSU School of Dentistry, and this is my expert tip of the day. We oftentimes have patients that come to us with a failing dentition. And the first thing we think is, let's give them something fixed, because that's what they had before, teeth that are fixed. But it doesn't really mean that that's the best treatment plan for them. There's considerations that we have to take. The first thing is, remember that our patients don't grow younger, that their dexterity is gonna lower as they age. So perhaps explaining to the patients that, yes, I can give you something fixed now, that does not mean that I'm not gonna change this prosthetic design down the road. If we decide to go the fixed route, we need to understand the way this prosthesis behave, specifically also how the materials we do them out of behave. For example, if we do a zirconia prosthesis and we're gonna oppose it against a plastic prosthesis made out of acrylic, then we might consider, instead of using conventional teeth, using nanohybrid composite teeth, because these teeth are gonna wear much, much less than your conventional PMMA teeth. So if we take these things into consideration and have an adequate prosthetic design, I think our restorations are gonna be very long lasting. This is my expert tip of the day. Thank you.